Good morning, everybody.
Good morning.
My name is Travis Robbins. I own Robbins Rehabilitation. Anybody heard of Robbins Rehabilitation before? I know some of you in here have. Okay. So we're a privately owned physical therapy company here in the Lehigh Valley. We have 5 locations. Our one most east is in Phillipsburg, New Jersey. Our one most west is in Upper Macungie, PA. I'm going to tell you a little bit of a brief story about physical therapy and how I came to kind of specialize in low back pain. Anybody here have low back pain? Okay, you're in the right place. I love when these lectures are on like crappy days because I didn't take someone away from like a really nice day, so I'm happy the weather's like this today. So, follow along on your worksheet here. If some of you like went ahead and filled it out, I love that. Like you're trying to guess the answers, that's awesome. But I'm going to answer all these questions, so going to be minimal involvement from you. Except for if you guys have questions about anything. So this is like super interactive. If I'm in the middle of something, just throw something at me, raise your hand, yell, and we'll answer all the questions that you have. Okay? So what is Robbins Rehabilitation and why should you care? We talked a little bit about that. Who is Travis Robbins? That's me. And why should you care? So I'm going to tell you kind of my story of physical therapy and how I came to specialize in low back pain. So got out of physical therapy school a while ago. I'm not going to tell you when, but it was more than a couple years ago. And when you get out of PT school, anybody here just get out of PT school? Oh, sorry, okay, good. You get out of PT school, you've got all this knowledge. Okay, Katie's one of my therapists. She's got way more knowledge than I had when I came out of PT school. PTs are now in doctorate programs. So if you go see a new grad PT, they have a doctorate. They're way more educated than the old PTs like me. I just have a master's degree. Okay, but what happened was, you get out of school, you think you know everything, right? You've learned a lot of stuff, you've got some experience, and you think you know a lot of stuff. And I got out of school, and what happened was, the long story is that I started out in Boston. On Monday, Wednesday, Friday, all my patients spoke Russian. On Tuesday, Thursday, they all spoke Spanish. So I learned language there, which was great. But I didn't learn a lot about PT because I didn't have... physical therapy school is in a tough boat where they have to kind of teach you a little bit about everything. So PTs are in outpatient clinics like this. They're in hospital settings. They're in school districts. They're on sports teams. So they teach you a little bit about everything. And then when you get out, you kind of specialize in what you want to specialize in. Okay? So I know a little bit about stuff, but I didn't really have the experience to back up what I was doing. So what happened was I started in Boston, worked there for a little while, and ended up moving down to this area. And I'm like unemployable. I can't work for other people. So at the age of 23, I opened up my own practice, right? So when I first started out, people that came in with back pain, the percentages of my ability to help them kind of looked like this. So about 50% of them were getting better. Like I helped them out a little bit, but we got to a point where it's like, yeah, you helped me out, but I didn't really get kind of what I was looking for. You're a nice guy. Thanks for trying, but I guess, you know, I've got to deal with it or find some other way to fix it. About 25% of people, I fixed anything that was wrong with them. They wanted to adopt me as their second son, and everything went great, which made me feel really great. And about 25% of people, no matter what I did, I could not help them. Okay? I tried everything. Throw the kitchen sink at them. That's what we tell our therapists not to do now, but we would try everything, and I just couldn't help them. Okay? So I'm a pretty competitive guy, right? So this doesn't make me happy. I'm like trying to figure out what's going on. There's more training. There's all sorts of additional stuff I can do, but I didn't exactly know where to go with it. So I kept trying, but didn't get the results that I wanted. And then what happened was a guy walked into my clinic. And we still, to this day, call him Super Dave. So that's what's on your sheet there. So walks to my clinic, drops off a 5-page resume. So anybody that knows about job applications, it's a little bit different now. But you're supposed to keep a resume to like 1 page, right? You don't want to put too much on there. Well, this guy filled out 5 pages, front and back, 8 fonts, and had all of the classifications and all the different things that he had learned, and walked out. And so me and my brother, at the time, we were in the Allentown clinic. So I have a twin brother who's a physical therapist. He works in our Easton office. So you'll never really know if it's me or him. So we pick up the resume, and we look at it. I was like, well, I think we probably should hire this guy because he knows a lot of stuff, right? So he was a fellow in the American Academy of Manual Physical Therapy. So somewhere on your papers there, there'll be a bunch of letters after my name. FAAOMPT. PTs love to put letters after the name. It's like alphabet soup, right? So what that means is he got a special certification after his normal schooling that that taught him that extra level of stuff that he didn't get from physical therapy school. And so I decided to do the same thing. So it's about 2.5 years of school, and then another 2 years of fellowship training underneath somebody in faculty. Okay? So it involves different things that aren't covered a lot in physical therapy school. They're starting to cover a little bit more there. Mobilization and manipulation. Anybody ever been manipulated, gone to a chiropractor, gotten an adjustment? Okay, so chiropractors like to think they own adjustment and manipulation, but lots of people do manipulations. So if you ever go to a doctor that has DO after their name, that's Doctor of Osteopathy, maybe you've gone to a DO and they've done some manipulation with you. Physical therapists do it. It's actually a requirement in physical therapy school that they have to cover it now. But it's not something that we went over when I went to school. So it's a lot of hands-on manual therapy, mobilization, manipulation of joints that fixes a lot of problems that I wasn't fixing before, right? So now what happens is about 90% of the patients that come in to see me get a complete resolution of symptoms, and about 10% are still, I don't quite exactly get them to where they want to be. I still don't like to admit this, but there are some things that physical therapy are not going to fix. But we'll talk about later too what happens to those 10%. That doesn't mean that we're going to roll off the edge of a cliff in a wheelchair. It means there's just other things that we're going to do to try to help you with your back. Okay? And now what I do, and I talk a lot about the roles that I have as a person. Everybody has different roles here. I'm a husband. I'm a father of 4 kids. I'm a business owner, 5 locations. I'm a physical therapist. I'm a soccer coach. That's what I'll be doing later today. But probably one of my favorite of those roles is an educator. Okay, so that's why you guys are here today to hear me talk about back pain. Okay, so I teach this stuff to our students, PT students that come in. I teach this to our new therapists that come in. I teach this to universities in the area. I teach at Widener. I teach at DeSales. There's lots of different places that I teach this, but probably my favorite 45 minutes of the week is right now, because I get to teach you guys about back pain. You don't have to have an advanced degree to understand what I'm telling you today. You just have to pay attention and learn a little bit about back pain, and that's the goal today. So I'm really excited about the next 30 minutes here or so. All right, so let's fill this out. The sciatic nerve is the what nerve in the body? What do you think that is?
Longest.
Yeah, largest or longest. I'll take either of those. Okay, the sciatic nerve is really big. Okay, it goes down starting from your low back, and it goes down the back of your leg. When it gets to kind of the middle of your hamstring in here, it's the thickness of your thumb. Okay, so that's how big this thing is. Right? And then as it goes down past the leg here, about a couple centimeters above the knee, it kind of splits off into 2 other nerves. Anybody know what the other 2 nerves are? You can't answer this if you're a physical therapist. So it's the tibial nerve. Right, tibial nerve kind of runs down on the inside, and the peroneal nerve runs down on the outside. Okay, so that's not in there, but that's extra credit. Okay, so those are where it says it's actually 2 nerves. You can write that in there if you want. Okay, it travels from the low back, so we talked about that, down the leg into the foot. It actually ends in your foot. Okay, anybody here that there's a lot of nerve endings in the foot? Okay, that's where the nerve kind of ends. Can't go any further, right? Okay, sciatica sufferers may experience what numbness or what in the leg?
Tingling.
Pain. Okay, yep. Numbness or tingling. Perfect. Okay, sounds like some people in this room have already experienced that. So, let's ask a question. If the pain, numbness, or tingling is reproducible, okay, meaning you can do something to make that pain worse or better, if so, then it's likely reducible. Okay? So if you come into my clinic and you say, man, I got back pain, unrelenting, never goes away. If I sit, it's worse. If I stand, it's worse. If there's nothing I can do to change this, that becomes something that we have to refer you out for. Okay? So that's some kind of significant problem that we have to work on. But if you say, yeah, my pain gets worse when I stand and walk around at the grocery store, but if I sit, then it gets a lot better, it goes away. Or if someone says, yeah, when I bend over to tie my shoes, my pain is really bad, but I can get into a position where it doesn't bother me as much, then you're someone that's probably going to be in this 90% that's appropriate for physical therapy. And we're going to go over this a little bit pretty soon here. All right, so this is the interactive part. Everybody stand up. If you don't want to stand up, you're having pain, and it bothers you, you don't have to, but this will be worth your time. So everybody that wants to, kind of stand up. All right, and we're going to go through a couple motions, and if you have pain with any of these motions, I want you to circle them on this page here, okay? So first one is easy. I want you to keep your legs straight, okay? And you're just going to kind of bend down towards your toes, only as far as you want to go, okay? and then stay there for a second, and then come back up. Okay? So if that made your back pain worse, then just circle that bit. Okay? Next thing we're going to do is we're just going to bend backwards. So you're going to put your hands on your hips here, and then you're just going to try to slowly extend back. Don't fall backwards into the person behind you. Okay? And just kind of see what that feels like, and then come back to where you started. Okay? And if that made that worse, then circle that there. All right. So now we're going to go bending to the right. Okay? So all you're going to do is you're going to take your hand, I want you to slide it down your leg. Okay, so you're going right over to the right. Okay? And then come back up. And if that made your back pain worse, then make sure you circle that, because I get my left and my right screwed up all the time. We do the left next. Left. Going to bend down to the left. Same thing. Oh man, I heard an owl out there. That wasn't All right. Did any of those motions make anybody's back pain worse?
Yeah, the bending to the right and bending backwards.
Bending to the right. Who said that? Bending right and bending backwards.
Bending right and bending backwards.
Okay. Would you be willing to come up here and have me fix that?
Yeah.
Okay. All right, guys. So write down your notes. You guys can sit down now. All right. You can put your stuff right here. Man, I may have stuck my foot in my mouth. Come up and fix that. Oh, that was pretty easy. Now I got to fix it. All right. Would you mind telling us just a little bit about your back pain? Like, well, how long ago did you start having back pain?
99.
Okay, so a long time ago.
Yeah.
Okay.
I had an accident, and I got herniated discs in the neck and lower back, and stenosis,
Okay. All right. And what kind of activities make the pain worse?
sitting, walking, just standing like this is from here to
Sorry about
here.
it. And how far down your leg does it go?
It goes all the way down.
All the way down. Okay. And is the pain on one side or the other, or is it on both sides?
It's worse on this side, on the right.
Worse on this side. Okay. All right. So go ahead and stand here for me, please. All right. And you said bending which way was bothering you more? That way makes this pain on the left-hand side.
Mm-hmm.
Okay. All right. So go ahead and do this for me. Just kind of slide this down there. And where are you having the pain? Is it here, a little bit lower?
Here, and going down.
Down there. All right. And then come back up. All right. Now I want you to do the same thing, except I'm going to put some pressure here. So left hand outside. And when I do that, pain worse, better, same?
It's better.
Okay. All right, come back up. All right, so that's what we mean, like if there's something that we can do to change it, like if it made that pain worse, that's not really a bad thing for me either, because I can kind of use that information to find out what's going on
Yeah, it's better when you do.
when I do that. Okay, let me know why that is? Okay, okay. Yeah, close to that, right? So anybody ever use a back brace? Okay, all right. Does it feel good when you wear it? No? Some people it doesn't. Some people, for acute back pain, that's one of the most effective things you can do to try to alleviate back pain is put a back brace on. Why is that? Because usually what's happening is that back brace, hold on, you can't run away yet, we gotta fix this. Sorry. What's your name?
Diane.
Diane, okay, great. All right, so if I apply pressure somewhere and someone's having pain with emotion one way, I'm kind of stabilizing that, right? So if I do that and you say, oh yeah, it feels a little bit better, okay? I'm just doing the job that your muscles are supposed to be doing, okay? So that's one indication. There's probably a couple things that are going on here, but one indication that the muscles that are supposed to stabilize that motion are not turning on properly, okay? So that's just one piece of information. So let's have you lay down on your back on the table here, head on the pillow. All right, so from here, bend both your knees. Push down with your feet and lift your hips up off the table. Good. And then back down. And then relax. We're going to flatten out here. Okay. So as you lay here, this leg's a little bit longer than this leg. Okay. Did you know that?
Yeah, the chiropractor told me that.
Okay. Anybody have their chiropractor tell you something like that? Yep. It's pretty common. So is this leg really longer than this leg? Like if we did an X-ray and measured the femur and the tibia, would that be longer? Probably not. Okay, this is probably a functional leg length discrepancy, which means that it's not the length of the bones that's causing the problem. It's probably, most of the time, it gets a little bit complicated, but most of the time, if this right leg is longer, then this ilium, so if I say put your hands on your hips, you're putting them on these big pelvic bones that are here. Those are your iliums. This ilium is rotated forward, which would make this leg longer. Okay? Or this ilium might be rotated backwards, which is making that leg shorter. Okay? It's not always the side of symptoms. A lot of times it is. But it's not always the side of symptoms. So if you're having pain on this side, you might think, well, it's probably this one that's kind of rotated back. The only way to find out is to see how the joint is moving. Usually the one that's stuck, the one that's not moving the way that it should, is the one that's causing the problem. So are you okay laying on your stomach?
Mm-hmm.
Okay, so go ahead and lay on your stomach for me. And all I'm going to do is a mobility test to just kind of see how the SI joints are moving. So there's two SI joints. So S is sacrum, that's your tailbone, right?
Mm-hmm.
I is ilium, that's those big hip bones here. Those two bones come together, and there's a joint on either side. Right? So from here, the right SI joint is right here. You're going to feel me kind of pull up on your hip here. Try to relax. I know it's not the most comfortable thing for you.
When you press on it,
Yeah. When I press in the front or the back?
the back.
Okay. Yep. And usually, an irritated SI joint will not be very happy when you put pressure into it. And that's because when it rotates, the ligaments that are attached there get kind of taut, and then when those ligaments are taut, they're pretty sensitive to touch. Okay? So I'm trying to find out. Ooh, this is all right. Relax here. There you go. So this joint doesn't move a lot. It's not like an elbow or a wrist or something like that, but it has to move some. Okay? So if these two bones are touching one another, normal motion looks like this. If it moves excessively, that's not good. Okay? And if it's stiff and it doesn't move a lot, that's not good either. You have to have kind of a balanced effect there. And you want to have symmetry on both sides. So you don't want one side that's moving more or less than the other. Okay? And then just relax. There you go. Yeah. So to me, this side is not moving. Yeah, so that even feels stiff here. Okay. Are you okay laying on your right side?
Mm-hmm.
Okay, lay on your right side.
Okay. This one?
Oh, your other right.
See,
50-50. This is not exclusive to you. Ask anybody who treats me, if I say lay on your stomach, 50-50 shot that they're going to lay on their stomach. The other one lays in the back. Right or left, same thing. So that's normal. Don't feel bad about that. All right. So kind of relax here. So I think this side is rotated back. So all I'm going to do is immobilization to kind of push it forward. Okay? So just kind of relax here. And you're going to feel me pull in here. Are you doing okay?
Mm-hmm.
Okay, good. So this thing isn't, when we say joint position, a lot of people think of dislocation. So it's not like it's dislocated. If it was dislocated, you wouldn't be walking in here. Okay? That's too much. But it's just not in the proper position. Okay? So getting things lined up is really important when you're trying to fix a back problem. Right? So if we do this mobilization and it moves better and we stand up and the leg length is the same, did I fix the problem? No, not really. I helped it out. We're kind of getting closer to what's going on. But the bigger issue probably is that she can't kind of bend to the side without joint irritation because she's not turning on muscles properly in her core. We'll talk about that. And give me your bottom hand here. So this one's your top one. Give me your bottom one. Just kind of, and now you're going to kind of pull me, okay? And I'm going to pull you with the same amount of force, okay? So yeah, perfect. Good. The tricky part is down here. You got to kind of relax, and I'm pushing this forward a little bit. Okay, so here, good. Doing okay there?
Yes. Uh-huh.
Yeah, you feel pressure. If it starts to become uncomfortable, then just let me know. And so there's lots of different ways that you can get this thing. You can use a muscle energy technique. You can do a manipulation. Hey, I'm just going to mobilize it, okay? Because I don't know enough about your medical history, and I haven't asked you enough questions to know if we can do that. Okay, you doing okay there?
Mm-hmm.
All right, and lay back over on your stomach for me. Okay, feels good. All right, lay back over onto your back.
Yeah, the chiropractor always tells me this out all the time at my
Okay. Yep. So let's talk about that. Does anybody go back to their chiropractor and like keep having to get a leg length discrepancy issue fixed? Right.
Mm-hmm.
So depending on what kind of chiropractic you have, and this isn't about chiropractors versus physical therapists. I go to a chiropractor. I love chiropractors. Okay. So that's not what this is about. Depending on the kind of chiropractic you get, they are experts at joint manipulation and aligning things. They're great at that. Okay. What they kind of fail on and what physical therapy does more is, great, that's out of position, but I've got to teach you how to keep it in position, or you have to keep coming back to me for me to fix it. You shouldn't rely on me for your health, okay? I should help you out. We talk a lot about being a coach, right? So I'm supposed to figure this stuff out, help you understand it, give you the tools to fix it for the long term, okay? So bend both your knees, good. Push down with your feet, lift your hips up off the table. So if you have to keep going back to the chiropractor to get that fixed, does it make sense that you're probably not activating the proper muscles to stabilize what's going on here, and it keeps kind of falling out of position, right? All right, so I don't know if you guys believe me or not, But this is more normal now. The joint mobility is normal. Go ahead and stand up, and let's see what happens when you bend to the side and bend to the back. So that was the worst pain, right? When you bend to the left side and then when you extend it back. So here, what happens now?
It's better.
Better. Okay, and range of motion is better. You guys probably don't pick up on that, but that feels a little bit better, right?
It still hurts right in here.
Yep. Still hurts there because, again, I didn't fix this problem by getting the alignment properly corrected, right? I still got to go in and fix what's going on here to maintain that, right?
As you go in.
Mm-hmm. I don't like you actually go in there. I've got to teach you how to turn on muscles properly so that you can do it. Okay. All right, let's have a hand. All right. No problem. Okay. So, next is the number one single biggest mistake sciatica and low back pain sufferers make is what, and those dashes are for a word. We could do like hangman. Good. Okay. Ignore it. Anybody do that? Anybody have back pain? Like, yeah, it's fine, go away, right? Yep. Sometimes it does. I have a friend of mine is a doctor that works with me, and treating your friends and family members are just like the worst proposition because if they're still having problems after, it just doesn't go well. So he came a couple times and then just ignored it. And then I was golfing with him one day. He falls out of the golf cart because he may or may not have had too many drinks, and lands on his SI joint. Stands up. Pain's gone, hasn't had it back. Okay, so he kind of ignored it and got lucky. I don't suggest that for a treatment strategy, falling out of a golf cart. But if you ignore it, it's probably not going to go away. Okay, so what are your options for back pain? So we talked about the first one. That's ignore it. All right. So you guys want the fire alarm analogy or the leaky roof analogy?
Fire alarm.
Fire alarm. Okay. So we're in a room right now, right? There's fire alarms. Hopefully they're working. Fire alarm goes off. Okay. What are my possible options of things that I can do? Don't overthink it.
Yeah, without
Yeah. Okay. I could walk out of here, get in my car, go home, and guess what? The problem's kind of gone, right? But if I come back here next week and try to treat patients, it's probably going to be tough if I let the place burn down. Okay? I could pick up the phone, or ask one of you guys to pick up the phone and call 911, get the fire authorities here, and take care of the problem before it becomes a bigger problem. Okay? So that's kind of looking at ignoring it versus actually doing something about it. I could completely walk out of here, we could all go home, and we'd be fine, except when we came back here on Monday, well, you guys don't have to come back here on Monday, but if I came back here on Monday, we'd kind of be in trouble, right? And that's what happens a lot with back pain. Next thing you can do is alter it, okay? So that's what number 2 is. Pain medication or back brace are super common things that we see in altercation. So anybody been on pain medication for their back? Yeah, probably quite a few of you. Muscle relaxers, that's another common one. Unfortunately, now what I'm seeing is antidepressants. Right? 50% of the people that come in that have back pain, their physician has put them on antidepressants. They're just sad. They don't really have mechanical back pain. Right?
I used to do that years ago.
Yeah. Yeah. So medications and altering it with a back brace too. So we talked about that a little bit. You guys ever go into like Home Depot and Lowe's and see the guys with the back braces? Okay. So those guys' backs feel pretty good. I'm going to see that guy when he takes it off and he bends down to untie his boot every single time. Okay? Because now what? You've done the job that the muscles are supposed to do to maintain stability in your spine. And then you take that away and something bad happens. Your body is an efficiency machine. If you do something for your body's like, great, I don't have to do this anymore. Right? So if you put a back brace on, the muscles turn off. You know, even in standing and moving around, even muscles in dysfunction, they'll turn on a little bit to kind of maintain some strength and stability. You put a back brace on, those muscles turn off, they atrophy, and I don't know if you guys have seen any research, but like 24 hours of bed rest is enough to cause atrophy in muscles. Okay? So when you have that for a long period of time, you're just altering it. And sometimes, unfortunately, like I said, it's really effective in getting rid of some back pain. And short-term use of some of this stuff, I'm not opposed to. It's the long-term strategy. Like, these things are not a long-term strategy to get rid of back pain. Okay? The next thing you do is you can change it. All right? So has anybody had physical therapy, chiropractic, that kind of stuff? Yeah. Okay. So you've done some stuff to try to change it, right? Maybe you didn't get the outcomes that you were looking for, but you're taking some effort to change it, but maybe you haven't had the best results. So we'll talk about that. All right. The 3 common causes of low back pain and sciatica. Okay? So number 1, herniated what? Disc. All right, everybody knows that. Has anybody had diagnostic testing here? Maybe it showed some kind of disc problem? Okay. All right, so diagnostic testing to me can be kind of scary, right? Because what happens? You guys see your MRI report? Big long report, stuff at the end, they summarize it, right? I've never gotten an MRI report back that said, Looks good. It doesn't happen. Like, I get MRI reports on kids' back, and there's something in there, okay? You're never going to get an MRI report back on a spine if you're over the age of 20, and even then, you're probably not going to get a clean MRI. It doesn't happen, okay? So there's findings in there, and it's information, right? So it's important, it's information, it's stuff that we use, but a lot of my patients they really identify with their MRI findings. They're like, man, I got a herniated disc. I guess, like, I've got back pain like that. I'm stuck with this now for the rest of my life, right? So I herniated 2 discs in my lower spine when I was 19 playing college football. Almost never had back pain. Okay? Every once in a while I do when I don't do what I tell everybody else to do, and it reminds me. But absent of that, I don't have any back pain. Okay? So now I'm not here to tell you like I'm the perfect example of what happens when you have a herniated disc. But I want you guys to know that just because you have findings that say there's something going on in your back, that doesn't mean that you're never going to get rid of your back pain. Okay? So pain, if you have a herniated disc, do you guys know pain with bending which way do you think? I'll give 2 options, forward or backward. What's going to make it better? What's that?
Any.
That's true, it can be any, okay?
Forward.
A little bit more common forward, okay? So we'll kind of explain what's going on there. So we're going to go some basic anatomy. I'm not the best artist, but... So, I got pretty good at it. All right, so here is your disc. Here is, we'll go L5 and L4. Got it? Okay. All right, so this is let me know what the job of the disc is.
Cushion.
Perfect, thank you. That is some of what the job of the disc is. That's what everybody says. Its most important job is that it's a ligament. Does anybody know what a ligament is? Not Katie? A ligament attaches bone to bone. Anybody ever sprain their ankle and know someone that sprains their ankle? Okay, here's what happens in an ankle sprain. You turn it over, there's 3 main ligaments on the outside of your ankle. Those things get stretched out or they get ruptured, they actually tear. And then what happens? Typically someone that sprains their ankle, they typically do it over and over again, right? Okay? So one of the things that maintains the stability in the joints in the outside of your ankle are these ligaments. When they're stretched out, then they don't do as good a job as they used to. Okay? So it attaches bone to bone, and with sprains in the ankle, you can recruit other muscles around there to kind of make up for the lack of stability there. A little bit tougher in the lumbar spine, okay? But it's a ligament. It attaches this bone to this bone, okay? So we talked about joint motion, here and here, okay? So you need some motion. If you didn't have any motion, it'd be fused. You don't want that, okay? It wouldn't move at all. If you have too much motion, that's what causes the problem. So it was probably what was happening up here when we go to the side. If this ligament isn't doing the job that it's supposed to, there's some SI stuff going on, but there's probably some lumbar stuff going on too. If it's not doing the job of maintaining that, you've got to recruit the muscles around here, both locally and globally, to make sure that that doesn't move excessively. Why? Because, here's the problem. Going down here is what?
Nerves.
Yeah? So, lots of nerves. This is your spinal cord. Okay? And right behind this disc is the spinal cord, and there's not much space in there for anything. Okay? There's not space for a herniation, there's not space for a disc bulge, there's not space for just an irritation that causes inflammation. Any kind of increase in what's here in terms of fluid puts pressure on the nerves, and that causes pain that goes down the back. Okay? Even light pressure on a nerve can cause significant symptoms. Okay? And then, out of here, run the nerves that come together that make your sciatic nerve. Okay? So most sciatic irritation is caused from a nerve root impingement because there's something going on here. Right? And this is the vertebral foramen, which is a fancy word for the hole that the nerve comes out of. Okay? So if there's any kind of problem with that disc, so this is the front of your body, this is the back of your body, does it make sense that if you have a disc problem, when you bend forward, you put pressure here, and then what happens to that material? It kind of goes that way and it can put pressure. Yeah. So most people with a disc problem, although you're right, it can be forward and backward. When it's like a really, we call them like a hot disc, like a really recent one, or a really active one, then both forward and backward can bother, but mostly forward. Okay? So what's next here? Pain with bending forward. Usually, how young or younger do you think?
Usually happens in the 30s.
Yeah, usually in your 30s. So typically like 40 or under. Okay, that's going to be like the biggest problem. Not always. Okay, there's no always in anything that we're going to talk about. But for the most part, this is a person that's under 40 that's having this problem. And that's because as you age, this disc loses some of its water content. Okay? And you actually, one of the reasons why you get a little bit shorter as you get older is for that. Okay? Anybody getting a little bit shorter as they're getting older? Yeah? My dad on his driver's license still says 6 feet. I can't give him a change. I'm just going to 6 feet. Okay? So, what's happening is part of it is that it loses some of the water content. So when you lose the water content, you have less of a chance of that disc causing a problem. Okay? And then also the vertebral bodies, like the body height, actually changes a little bit. So that's what causes some of your kind of getting shorter as you get older. Okay? Next one, stenosis, DDD. Anybody know what that stands for? Degenerative disc disease. You ever hear that? Or probably the most popular term for this is what? Starts with an A?
Arthritis.
Yeah, arthritis, right?
Arthur.
Right? Yeah, old Arthur, right? Yeah. Okay, so that's arthritis. So this is usually a different looking problem than this problem, okay? So now, as these discs get smaller, the vertebral foramen gets smaller, now there's less space for this nerve root to come out, okay? And what happens is you typically see the little old lady at the grocery store, right? Okay? So you ever see someone that kind of is in the grocery store like this and they're really leaning on this cart? Every time I see that, I put like a gallon of water in the front of it because I'm always thinking that the cart's going to flop up when she does that. But what happens is they do that for a reason, okay? And we know why that reason is? Yeah, right? So your body will naturally put itself in a position to cause the least amount of pain without you even knowing it. It's really smart. It's way smarter than me, way smarter than us. It does that naturally, right? So this here, it says pain with standing or walking. And usually relieved with sitting. Okay? So anybody walk in the grocery store or stand for a long period of time, have pain, sit down, and the pain gets better? Anybody have that? Yeah. Okay.
As soon as I stop.
Yep.
As soon as I walk, it hurts.
Yep.
As soon as I stop and sit down.
Goes away. Yeah.
It goes away.
This is like textbook stenosis. Okay, that if someone says that, there's a 99% chance they have stenosis.
What if you have it with sitting also, standing and walking, but you have it with sitting too?
You have pain with sitting too?
Yeah.
Well, there's probably a couple things going on.
Mine only goes away when I'm laying flat.
Yep. So what's that?
So mine only goes away when I'm laying down.
Okay. Yeah. So you have to find some kind of position.
I need an L5 and the sciatic is pinched and.
Mhm. Yep. Yep. So that's super common. Yep. So what's happening is, as you're getting older, you're losing space here. There's less room for error here. Like when you're younger, this is bigger. You could have, you could get away with poor body mechanics. You could get away with poor tissue mobility, nerve mobility, poor posture. You can get away with that, but then eventually it kind of catches up with you. Right? So if you're someone that stands and immediately has pain, and then you go to sit down and it goes away, 99% chance you have stenosis. Right? And those problems are treated differently. Right? And the last thing that we're going to talk about is SI joint. So we talked about that a little bit, or sacroiliac joint is what you fill in there. Problem. Okay? And this is ages what to what, do you think? Okay, so we got 40, 50. Okay. So the answer is 9 to 90. Okay? So I write that in there because I've treated someone that's 9 years old with SI joint dysfunction, and I've treated people that are 90 that have SI joint dysfunction. Usually a younger problem, usually more with females. Usually more females with one pregnancy, usually more females with multiple pregnancy, because their hormones are a little bit different. Right? And usually it's a problem with excessive motion. Okay, so we talked about SI joint problem here, and what did I say? I said the joint's stuck. So now I'm saying excessive motion, like they lose too much, so what's happening? So it's usually that now when we unstick that, and now I felt it, like now I get it to move, and her left side moves more than her right side. So it's usually something that's moving too much. You get into a position, bending over, sitting for a long period of time. My rotational athletes, so golfers, people that play tennis, line workers, so my factory workers that are like doing the same repetitive, rotation over and over again, that kind of stuff. You get into one position, it's like, and then it gets stuck, and then that's when the SI joint doesn't move properly. It needs to be kind of unstuck. But again, the problem is, the immediate problem is that it's stuck, and I can fix that in 2 seconds, right? But the underlying problem is you're not stabilizing properly to maintain movement properly, so it keeps causing that problem. It keeps falling in. Okay? All right. So what does successful treatment look like? It sounds like everybody in this room has had some kind of treatment, right? Physical therapy, doctor, maybe pain management. Maybe you guys have done a lot of different stuff. You've had some kind of treatment, and I want to tell you about how to get into this circle here. So successful treatment, for me, is manual therapy. So if you've had physical therapy before, And no one did anything in terms of joint mobilization or assessment of joints or getting their hands on you, which seems kind of silly to me, but unfortunately I hear it over and over again. I see a lot of second, third, fourth opinion type PT stuff. If someone put you on a bike and gave you some stretches and watched you do some exercises, then there's a chance that that could work. It's really, really low. Okay, so hands-on manual physical therapy to mobilize the low back and the SI joint. Okay. So it's rare that someone comes in that doesn't require some kind of mobilization. I can't remember the last time that happened. You need to kind of start from a zero position. Same thing we talked about. Did I just fix her problem? No, but we're starting from a better position to try to teach her how to move and turn things on properly so that she can get rid of this back pain. Okay. Number 2 is exercise and education to stabilize the pelvis. So we talked earlier, right? I said, like, I'm a coach. So you guys were given, like, this amazing body, but no one got an instruction manual, right? Okay. So, and you can get away with really bad behavior for long periods of time and not have a problem. And then there's that one time that something bad happens, and then it's like, yeah, now we got to start paying attention to this, right? So a lot of my job is to kind of fix the joint dysfunction, fix the nerve mobility issues, teach exercise, but my most important job is to give you the instruction manual that you never got, right? So there's a correct way to bend down and pick something up. When it's at this height, when it's at this height. There's a correct way to bend down and pick something up. That's a pencil. That's 20 pounds. That's 40 pounds. There's a correct way to bend down and pick up your kid. Okay? And if you're not doing it, you can get away with it for very long periods of time. It's amazing. The human body's amazing how poorly you can treat it, and it still works. But at some point, you need some kind of intervention from someone that can teach you how this thing works. Okay? And it's not hard. It's not rocket science. I am not the smartest guy in the world. Ask my wife. Okay? It's not hard. Okay? It's just that you guys don't have the specialized knowledge in order to get that to work. Okay? All right. And then number 3 there, sometimes we'll use traction. Everybody been on a traction table? Okay. All right, so you kind of put a belt on, and this machine kind of stretches you out. Looks like medieval torture, right? That kind of thing. Okay. So distraction of the joint can be helpful. Anybody ever seen an inversion table?
Yeah.
Okay.
We have one.
Okay, you have one? Do you use it?
Yeah.
Does it help?
Yes.
Okay.
I've used it a few times, but I don't have anywhere to set it up regularly to get on it every day.
Okay.
It helps me for like a day or two, and then if I don't use it, it goes back.
So why does it only help you for a day or two?
Because she does
Gravity.
it frequently.
Yeah. Yeah. Yeah, that's true.
You're taking the
So
pressure off.
you're distracting, right? Okay, so there's various parts. We're not going to get into a research, discussion here, but there's some research that says that can do some distraction. What's the problem? You're not a back. You don't spend all day upside down, right? That's not a very functional position, right? So traction for us is an unweighting treadmill. So we have a treadmill in 2 of our offices where you put a vest on, and I can take as much as 200 pounds off your body weight, and then you can walk, right? So when you do traction in a functional place, like in walking, then it's more effective. Does it fix like all back problems? No, but it's a really cool tool that we use. So, and it's usually it's not the first thing we go to, right? Because that, again, is not 100% functional, right? So if you feel great walking in the treadmill and I take, 50 pounds off of you, unless you're going to lose 50 pounds in like the next 2 days, which is probably not going to happen, that's not very functional because I'm going to give you your weight right back, right? So it's helpful in kind of decreasing some symptoms, but again, not a great long-term strategy. Long-term strategy is for you to be able to function properly under normal gravity situations, doing everything you want to do.
How about the Vastine machine?
Yeah, anybody have Baxter? Usually from their chiropractor?
Yeah, that was
Okay.
long. It's called something else now. The old one was the Vastine
Yep.
machine.
Yep. So it's traction. It's like a supercharged form of traction where they're trying to like really decompress you. Again, not terribly functional for me. I've had some patients that do it and like helps them out with their pain. I'm for anything that helps, right? So if you go stand in the corner on your head for the next 10 minutes and it helps your back pain, you should probably do more of that, right? So do more of what works, right? So to answer your question, if that works, that's okay. It's not covered by insurance. It's usually a couple grand to get it. So I would rather you try exhaust some other things, but I'm for whatever works. I work with acupuncturists. I work with chiropractors. I work with holistic practitioners. I try to do everything I can, starting from lowest hanging fruit first, like all the stuff that normally works for this, and then once we get to the 10%, then we start getting a little bit more creative. Okay, go ahead and back.
What about walking on the treadmill in water?
Okay, so
Sort
same
of the
thing.
same thing?
Yep. So you're kind of unweighting yourself. It's a little bit different. Again, if you do that and it helps you out, if it decreases your symptoms, and then I can do more with you on the table, then I'm fine with that. Using that as a long-term solution is probably not the greatest thing, unless you have a pool and underwater treadmill. It's really awesome. Can I come over to your house? So, awesome piece of equipment, not accessible to everybody, and not a great long-term strategy. All right. So now we have to find out what are we going to do about it. Okay. So one is what? You can ignore it. You guys can walk out of here, say thanks, and just continue to ignore it, right? You can still alter it, right? Right? You can wear back braces, back pain, injections, you can take medications, you can do that, or you can change it. All right, so does anybody have any questions?
What if somebody has the neck pain and the back pain?
Yeah, common, especially people that have been in accidents. So we treat both things. The lower part of the lumbar spine and the lower part of the cervical spine are not that different. Okay, so a lot of the things look similar. There's some joints in there that are moving excessively. Okay, and anywhere in the spine where there's a segment that's not moving properly, the segment above and below that has to move excessively in order to make up for that lack of motion. Does that make sense? Okay, so there's two ways to address that. Okay, and here this goes back to I'm not a rocket scientist. The segment that's not moving, we whack that, right? Get that thing moving, mobilize it, manipulate it, whatever you have to do, self-mobilization, whatever is comfortable for you, and then we stabilize the segments above and below that. Okay, so the segments that are moving too much, you've got to turn on the muscles that control those segments. The segments that are not moving enough, if you mobilize those, you're just going to get to where you want to get to faster.
And what about the pain running all the way down the back, like in the scapula going all the way down, like the trigger points all over?
Yeah, so that's a great question. One of the things we have to do first when you come in for physical therapy is find out what tissue is causing the problem. Okay? So is it nerve tissue? Is it muscle tissue? Is it joint tissue? Right? And usually it's a combination of a couple things. But that, to answer your question, that can be your paraspinal muscles. They're just so irritated because they've been in pain for so long that they're just like constantly turning on. So that might require soft tissue mobilization. That might require joint mobilization, which then gets the soft tissue to calm down. That might require nerve mobilization. So it depends on the evaluation. Good question. Any other questions?
Do you take insurance?
Yeah, of course we take insurance. There's very few of them we don't take. We have cash pay options too, so not everybody has insurance. I mean, insurance anymore is becoming cash pay anyway, right? I mean, I've got a $4,000 deductible. My family plan is $1,800 a month. You know, I'm paying, unless my wife has another kid, then I'm paying for all of my health care up front. And we have no interest plans too, because, I mean, I have the same plan that you have. Probably not as good because I have to go to whatever insurance company and I've only got like 20 employees. You know, if you are working for a company that has a large number of employees, then it becomes, you know.
It's just me and my wife, so we have to buy our own.
Yep. Yep, so you're in the same boat with me, right? So I don't want money to kind of keep you from a pain-free back, right? So my favorite thing to do is educate and help people with back pain, right? So I have people that have been paying me $10 a month for the last 10 years. You know, as long as you're making some kind of payment, then the insurance company doesn't give me a hard time. Right? I can't waive copays, right? So then I avoid the contract I have with the insurance company. But as long as you're making some kind of effort towards some kind of balance, I'm not going anywhere. You know, that's fine. And we never charge interest. Yeah.
Need a referral? from a
Okay.
doctor?
Awesome question. All right. So if you have all states, for the most part, are direct access, and Pennsylvania is actually pretty good on direct access. Direct access means you can come to your physical therapist without a permission slip from your doctor. I love that.
Depending on the insurance plan.
What's that?
Depending on the insurance
Depending on your
plan.
insurance plan. Okay, so I can't remember the last time we had a commercial insurance. So commercial insurance meaning not Medicare that required a prescription. Sometimes it does.
Most HMOs and not, like I have a PPO now.
Mhm.
The PPO doesn't, but the HMO did.
Yeah, and there's a difference between a referral and a prescription. And I won't bore you guys with all the differences. But to answer your question, if we need some kind of communication with your doctor or your insurance company, we take care of all that. Yeah, so you guys aren't going to have to be like filling out forms or anything like that. But to answer your question, if you have Medicare, you can come in for an evaluation and I can treat you, but I do need a plan of care signed by your doctor. So what it usually looks like, you come in, we do the evaluation, we write up a plan of care, we send it to your doctor, and then they sign off on it. It's so rare that I have a doctor that doesn't sign off on it because they're so busy with other stuff. I mean, doctors are, like, primary care doctors are in a really tough spot, right? So they're they're generalists, right? So you go into the doctor, some guy's got back pain, another guy's got an ankle sprain, some guy's got the flu, and some guy's got this wart on his foot that needs to get taken care of, right? So the job of the doctor is to kind of send that stuff out, right? So typically your primary care doctor, they're not orthopedic specialists. Some are better than others, but you need to go to an orthopedic specialist that kind of specializes in back pain. So to answer your question, Medicare, if you have a prescription already, or if you call your doctor and say, I need a prescription for physical therapy, they'll sign it over. And then if they don't, then we do up a plan of care and send it to them. And then we just can't start treating you until we get that plan of care signed, which is not a big deal.
Did you say with direct access, you don't need a prescription?
Correct. You don't need a prescription for physical therapy. Yeah.
In the last few weeks, I found I have a pain on my left leg from the top to my knee.
Mm-hmm.
And when I go to lift my leg, this pulls.
Mm-hmm. And that's new?
Yeah, in the last few weeks.
Okay.
Yeah.
Yeah. And
The one day it was like I couldn't even hardly walk because I couldn't lift that leg. Because in fact, now when I lift it, I can feel this pull.
Amen.
Uh-huh.
All right, and then, have you had back pain in the past? And
Oh, yeah,
This is just like a new thing? Yep.
Yes.
So this is like the leaky roof analogy, right? So now I have to give you this one. So I had a leak in my roof, and you can see the water spots in the sheetrock, right? I don't know what you guys call it down here. I'm from New York. We call it sheetrock. Drywall, whatever you call it, right? Yeah. So, my house still works. You can turn on, I can cook on the stove, but that spot kept getting bigger and bigger and bigger. I should probably do something about that. Never did. And then eventually it rained really hard. And then I found out that not only was there, it was running down the side of my house, and then I woke up in the morning and my floorboards were all popped up. Okay? That's because the flashing on top of the roof was not installed correctly, and now I've got a $10,000 problem. I don't have, a $200 problem, right? So things will typically get worse if you don't do something about it. So you've got this back pain that's been going on. Oh, now I'm having this hip pain, or now I'm having this.
Yeah.
And it's just
funny,
getting
it
worse.
started and then I saw your thing and I thought, well, I'm going there, that's the way I'm starting.
Yeah. Yeah, and that's right. So everybody in here has different levels of pain, different stories, different kinds of pain. Hey, you just got to start doing something about it. Right? And maybe you haven't had the best direction on what to do. It's not your fault, right? So you go to your doctor. That's who you're supposed to go to. That's when you have problems, right? And they're doing the best they can to fix their problems, but they only have like a set of tools. My tools are my hands. Right? Can't write a script. Can't give me an injection. I don't want to do that. I want to fix the cause of the problem, right? But everybody's trying the best you can. Maybe you just haven't had the best direction. That makes sense? All right, I'm going to stick around and answer any questions you guys want. If you're interested, what we're doing today is anybody that attends here, we do a free screen. So if you want to learn more information from us, then you come in. It's a 30-minute screen. There's no obligation. We don't charge you anything. We don't take your insurance information unless you want us to. And you just get more of an in-depth evaluation. It would take me a while to go through the room and figure out everybody's problem. Better off if we just have you see myself or one of my physical therapists that can evaluate things. So 30 minutes group, we give you options on what you can do, and you guys make a decision from there. So we have 5 locations. When you go up front, you can schedule in any of them. Hey, you guys probably want to come see me. I'm going to tell you a secret. I'm not the best physical therapist that we have. Okay? All of the therapists that we hire have been trained by me. Okay? And they started out way better than I'm the only, myself and my brother are the only people in the company that don't have their doctorates. We're the dumbest people around. You don't want to be on our schedule. Right? If you want to, I'm out and up from Macungie, but find something that's close to your house that's convenient for you. All the therapists, I don't hire idiots. You can talk to these people, they're not dumb. All the people that I hire are amazing and they're better than me. Okay, so don't feel like you've got to get on my schedule to get this problem fixed. They all do a better job than I do.
If you have a disc or an MRI, that'd help you.
Yeah, bring it in, right? So, MRI findings, guess what? You're going to have something, okay? If you come to me with your MRI findings, then there's probably nothing that's going on today. Because if they found something really nasty, you wouldn't be in my office, right? So we take that into consideration. But what a lot of people think is they start physical therapy, they get an MRI, and they hand me the MRI, and they're like, okay, we're going to fix this. I'm like, we're not changing anything. I mean, you're still hypermobile in your lower lumbar spine. Your upper lumbar spine doesn't move properly. You have an SI joint problem, and your hips are kind of stiff. Okay? So we're not changing it.
What do you do about arthritis?
What do we do about it?
That's what I-
Yeah, so that's management, right? So am I going to take away the fact that you're having arthritis? Yeah, a little bit, because what's happening is you're irritating that from poor body mechanics. Right? If you're not setting yourself up for success, and also looking at hydration, a little bit of nutrition, like what you're putting into your body that's causing that inflammatory response, then I'm going to have some effect on that. Am I going to completely eliminate what's going on? Meaning, am I going to change your X-ray or MRI findings? No. But I can change how you move and walk, right? And that takes away the pain.
How do you figure out what's in making it inflamed?
What's causing it?
Yeah.
Mostly motions. Yeah, so it's a movement assessment, right? So if you're bending over and that's causing more problems, that's a certain cascade of things that are going on. If you're bending backwards or standing and walking and that's causing more problems, it's a certain cascade that's going on, and then we fix the mechanics around what's causing them.
Would you say, just a general statement, strengthening your core, is that fairly essential? No matter-
Awesome. Let's talk about core. What happens when I say strengthen your core? What do people think about?
Setups, crunches.
Yes, you guys are awesome. Sit-ups, crunches, planks, leg lifts. That's what you got to do, right?
No.
No! Okay, that's the worst thing you can do. Okay, so let's talk about what the core. I mean, can anybody tell me like what the muscles of the core are? Like, there's some muscles that make it up. So here, right in your belly, right? Maybe some of your back, some there too, right?
All around your waist.
All around your waist, right? So yeah, so it's not the muscles that you think of. Like those guys that and girls that have like six-pack abs, they don't get back pain, right? They're like strong, right? See, these muscles here do not have much to do with your core. Okay, your core is your inner unit. We call it inner unit because when we say core, people conjure up all these crazy things like bear down and like I'm gonna turn my core, and it's like it's really bad. Okay, your core is your transverse abdominis. This is a muscle that starts here, wraps all the way around your thoracolumbar fascia, and is like the barrel to your core. Okay, bothers me you can say that word, but I'll say it. Core. All right, top is your diaphragm. And you know what your diaphragm does?
Breathe.
Breathe, right?
Yeah.
Breathing is super important. We're going to give you guys a ton of breathing exercises. On the bottom is your pelvic floor. And you know what your pelvic floor does? Holds your organs up, right? Hey. And then what else? Multifidi muscles. So these muscles that run along the segments of your lumbar spine all the way up to your cervical spine that kind of stabilize those segments. Those are the muscles that we work on. And if you come in for physical therapy, we're going to have you guys do some goofy exercises. Like people think, oh yeah, I'm going to do some sit-ups and some leg lifts and that's how I turn on my core. You can do that, and you can get stronger for sure. But here's what you're doing. You're putting strength on top of dysfunction. Right? So you can do that, and you can definitely get stronger, and you can get six-pack abs if you want to do that. But you're not turning on the right muscles to improve the mechanics of the spine. Okay? And that's what I teach you. Okay? If you want to do that stuff after, then that's fine, but I've got to set you up for success, or else if you go do that stuff, we're going to run into more problems. You guys have great questions. Okay, so go ahead.
How do you feel about yoga?
I love yoga if it's done with the correct instructor. Okay, there's some yoga instructors like, keep stretching it, come on, we're going to get there. There's only specific ones that I would suggest because they are more orthopedic based and more willing to modify what's going on. Okay, if there's someone in yoga, everybody's doing the same thing in the room, get out of the room. Okay? So, but to answer your question, I love it. It's great when it's provided in the correct environment.
And what do you think of Tai Chi?
Love that too. Okay, that's more movement based, so that's kind of shifting more towards like Pilates, which is more strengthening than yoga. There's all different, like there's 2,500 different kinds of Christianity, right? So there's about as many kinds of yoga and Pilates and Tai Chi, and you got to find what works for you, right? So same thing. If you're doing Tai Chi class, everybody says to me, I don't have much time. I do Tai Chi, yoga, or Pilates. I'm like, try one, and if that one works for you, I don't stick with that. Do more of what works, do less of what doesn't work.
Yeah.
But good question. All right, guys, if you want to schedule, you can go up front and schedule with our schedules. If you guys want to ask me questions, I'll be up here. Thanks for giving me a little bit of your time today. I had a great time. It's the best 45 minutes of my week, so thanks, guys.
Thank you.